America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hello and welcome to another episode of Main Street Matters, America's small business megaphone. I'm Jordan Bruno, Vice President at Job Creators Network.
And I'm Toni Angelini, Senior Vice President of Advocacy and Operations for Job Creators Network.
Please subscribe to the show at salempodcastnetwork.com or wherever you get your podcasts. Today, we're joined by Red Taylor. Red is the founder of RedTaylorInsurance.com and CEO of Health Trust Financial Network, an independent insurance, wealth management, and financial services brokerage firm. He leads a team of more than 4,500 independent agents across the country. He is also the top representative of Metashare, a leading alternative to traditional health insurance. Red, welcome to Main Street Matters.
Yeah, thanks, Jordan. Great to be here with you and Toni. Excited to tap into your audience, and hopefully we'll be able to add a lot of great value to your listeners and viewers today.
Great. Well, Red, I don't know if you're aware, but of the 33 million small businesses in the U.S., the vast majority are sole proprietorships. So one of the biggest problems that we have is finding health insurance. Maybe you could just give our audience a little bit of background of your business and your value proposition to people looking for health insurance.
Thanks so much. I've been in the health insurance business now for about 25 years. I've owned a brokerage firm, my own agency, and it was one of those things that just kind of happened. I didn't go out looking for health insurance. I was actually coaching football. I was a high school and college football coach in my previous career, my previous life, and I was somebody that wanted to make an impact. I had a passion for helping others. I had a passion for making a positive difference, and when I realized that $2,500 a month, $2,700 a month to be a high school teacher and sit in a classroom 8 hours a day wasn't going to cut it for my growing family, then, it's almost like the good Lord sent me health insurance, sent me the insurance industry. And so figured out very, very early on that there's so many different facets to insurance. I mean, if as much of an imagination as you can have are the different facets and different elements to the insurance industry. So fortunately, I was able to decide to focus in on health insurance, and in particular, health insurance for those who are self-employed, who are small business owners, freelancers, entrepreneurs, because that's where the main pain topic is. When you hear Congress talking about health insurance, when you see commercials on TV, what they're focused on are the 30 million small business owners in America, because the other 90% get their health insurance through their employer, through their job. And so it's almost like it's ingrained in us, and we're programmed as employees to go every year during open enrollment and select box A, B, or C. Whatever, our employer provides us, we're going to pick whichever one fits our budget. We're going to roll with it. We really don't know a whole lot of how it works. But as those who are self-employed, your health insurance is generally, and I say generally, 96.7% of all those who are self-employed and small business owners, the number 2 expense behind their payroll is their health insurance. So you want to talk about a thorn in people's sides, and then every year during enrollment, whatever their open enrollment period is, their rates go up for no good reason whatsoever. And so I'm not always the favorite person that people like to talk to, but I may always be one of the most effective.
Great. Well, yeah, I mean, I think we've all seen the prices of health insurance just go through the roof. I think the latest data I saw was it's about $25,000 a year in annual premiums for coverage, and that's employer-sponsored coverage. So why do you think healthcare and health insurance has gotten so outrageously expensive?
Oh, that's a great question, Jordan. So, kind of get with me on this. So the human body has, an awful lot of working parts, right? And we humans value our life greatly. And, we can add in all of the science, all the medicine, all of, let's don't forget big pharma, and then the government. And so, what we have is an absolute broken, confusing system that enables humans and Americans to live much longer now than they ever have, but we're living with more disease. And so in order to live with all this more disease, then we have to be able to treat it and care for it in hospitals and facilities with drugs and pharmaceuticals and things of that nature. Let's throw on top of that the advent of the Affordable Care Act, okay, which was put into law, passed into law in 2010 in the dark of night, instituted in 2013, okay? And don't get me wrong, there are some people that the Affordable Care Act helps, okay, because we do it and we help our clients with it as well. But, in 2010, when the Affordable Care Act was passed, the largest health insurance company on the planet is United Healthcare, and they still are today. Well, their stock was trading at about $35, $36 a share. If you'll pull up your ticker right now, you're going to see it trading at about $600 a share. Okay. And I'm all for people making money. I'm a for-profit business myself. My wife and I, we've got 6 kids and I got 2 in college right now. So we got to earn a living. But if you look at one side of this table and they're all about the Affordable Care Act and government-sponsored health care and more intrusion from the government, let's don't kid ourselves at who that's really, really helping.
It must have been a wild ride for you. It sounds like you were about a decade into your health insurance company when Obamacare was passed. What was that like for you as sort of the entrepreneurial side of things, as a small business owner yourself? How did you adapt to such an incredibly invasive, set of policy proposals for the healthcare industry?
Oh, Toni, I thought I was going to die. Really and truly, I thought. My grandfather told me. He said if you ever want to be self-employed, he said you better get prepared for late nights in the dark of your home, quiet with nobody else around you, with your hand in your head and having absolutely zero answers and no vision of how you're going to be able to go on. And really and truly, that was the time, notwithstanding others as well, that happened, because there was a completely new set of rules that were thrown at us. I will say that I've got a blessing because in life, I've always been handled adversity, and I believe that adversity is going to come for us no matter what. When you wake up in the morning, tough times, tough scenarios, changes, problems are heading your way. Some days they head your way at 5 miles an hour. Other days it seems like they're heading your ways at 150 miles an hour, but they are heading your way. And so what I always thought about was, just show me the rules. Just let me figure out what the rules of the game are. And then it's my job to go out and find a way to win. And that's what I've been able to do. And we were able to do it pretty, fairly quickly. And winning in this industry has always gone back to service and always gone back to helping other people. Okay. With health insurance, like I said, it's a huge pain topic for folks. And there's an entire spectrum of the pain, but the number one pain spectrum for health insurance is the affordability. People can't afford health insurance. And so we've kind of made it our mission to help people find affordable health insurance. And then the second thing is a personal thing to me, because there's a lot of stuff out there that people can sell like me that, quite honestly, the average consumer, they don't understand it. They don't get it. Nobody gets health insurance. But secondly, and maybe most importantly to me, was I had to make sure that people had top quality major medical health care. If anybody ends up in the hospital, man, you have surgery, inpatient, outpatient medical procedures. God forbid you end up in the ICU unit. Cancer shows up, heart disease shows up, stroke, all the big stuff that nobody ever wants to deal with, but we know it happens. I got to know that I know that you're taken care of. And thankfully, we've done a really, really high level job and been excellent at those two elements over the years. That's why I feel like we've been successful.
So you said something before that triggered the memory. We've said here at Job Creators Network a lot. Health insurance is not health care. And there's an awful lot of people that think that just because someone can check the box that they're insured, that somehow they're also able to be well cared for in God forbid the event of some sort of a healthcare crisis. How do you sort of play into making sure that not only are people well insured, but that they are actually receiving the health care in, that exam room with their doctor, the health care that they need to get them better?
Yeah, that's a great question. It's difficult. I'll be honest with you, because it's an education perspective. We try to educate our clients as much as possible. Once again, it's not a really sexy topic. So, when you tell folks that you need to be diligent and you need to be prudent in the conversation that you're having with your doctor, you need to ask additional questions, and asking why is really, really good. Okay. Your doctor is, unfortunately, they have motives as well. And so, I was reading this morning on a publication on the sliding scale of what high blood pressure and hypertension used to be. Do you guys know that in 1938, a blood pressure of 200/100 was considered normal? Okay. And now if you go to your doctor and you tell them you got a blood pressure of 120/80 and you're over the age of 50, they're probably going to try to put you on some kind of meds. Okay. Well, why is that? Because that doctor has been inundated over and over and over again with quotas he has to meet, and pharmaceutical companies, reps that are rolling in there and pumping him full of samples. Okay. And, I'm not going to say that these guys are evil or they're bad or anything like that. I don't want to be a divisive force here, but let's be real and let's just recognize things for what there are. There's so many different elements and so many different factors at play. And just like with, the fact that none of us really like to get involved in politics. Oh, it's so divided. I'm red or I'm blue. You can't talk about it around Thanksgiving. Your neighbor's going to hate you and all this, that, and the other. Well, if you're not involved and you're not educated in politics, then some guy who is educated is going to be the one that's ruling over you. And you're not even going to know any, reason why, what's going on. I mean, we have a really crisis situation today. You want to talk about one of the factors that's increasing the cost of healthcare exponentially. Let's talk about the 20 million. What is it? People can talk and argue over the numbers, but it seems to me like there's somewhere in the neighborhood of 12 to 20 million, illegal immigrants in America now that have come in flooding through our borders over the last 3.5, 4 years due to the direct policies in the White House right now. Okay. Well, those people are getting free health insurance. Okay. Like guys like me, brokers like me who do this for a living. If there is an undocumented alien or illegal alien, whatever you want to call these people, they're still humans. They're still children of God, and they deserve it. Ain't their fault. Heck, you'd do it too if you were in their situation, right? You do anything you could to give your family a better opportunity and a better life. Okay. But that's not your responsibility, and it's not my responsibility to go and work hard to leave our families, to go and sacrifice our time for the money that we make. And then they take the money that we make and we go and pay for people's health care that aren't even supposed to be here by law. So yeah, it's driving up the cost of health care, and it's minimizing the access to doctors, to hospitals, to facilities, because if there are 20 million illegal aliens in America, illegal immigrants in America, okay, did we hire an adequate, proportional amount of doctors, nurses, hospitals, beds? No, didn't work that way.
So, Red, what do you say to people who are looking, like, how can people get cheaper, or let's say less expensive quality, less expensive, higher value health insurance?
Yeah, so here's what I would recommend to anyone. Okay. First and foremost, you need to shop your healthcare every year. Okay. Whoever your local independent insurance broker is that you feel good about, that you can trust, I would recommend that they at least have 10 years of experience in the industry. Why? Because it changes. It's crazy. It's up and down. It's tied to the political landscape literally each year. I mean, we just got through having to go through a scenario where, based on the Inflation Reduction Act that the Biden White House passed and the Kamala passed. Okay, I think she signed she was the passing vote. Yeah. Mm-hmm. So based on that, it took all of these private PPO plans that we were able to help people who were self-employed and relatively healthy. Okay. Didn't have all the Obamacare mandates on it. Wasn't Cadillac benefits, but if they ended up in the hospital or they needed a surgery, it'd pay up $1 million, $2 million, and we could save them 30, 40% on those. Okay. Well, they just took those away beginning October 1. So now we could only sell those plans for 30 to 60 to 90 days and not 12 months. So that hurt a lot of people. Okay. Secondly, you want to look at alternative types of healthcare. As you mentioned, I'm a huge proponent of faith-based healthcare sharing plans. Okay. We've got an exclusive relationship with the largest faith-based healthcare sharing program out there on the planet called Metashare, which is Christian care ministry. Guys, this is like health insurance for Christians. It's not health insurance. It is faith-based healthcare sharing. It's a 501(c)(3) faith-based not-for-profit Christian ministry, but these guys have done such an excellent high-level job of creating and producing a system, a functioning mechanism that looks, operates, and functions extremely similarly to traditional health insurance, traditional PPO plan, and we're able to save people literally half off of their health insurance. So like when we help people and save them $500, $700, $1,000 a month, that happens on a day-to-day, multiple times a day basis in our office. Okay. And so you want to talk about life-changing to an entrepreneur, give them back $500 a month in their budget and provide top quality major medical health care protection. If something big happens, and give them access to be able to go see their doctors, they can keep their doctors, their hospitals. It's life-changing.
Yeah, one of the things we talk a lot about to reduce costs is getting the bureaucrats and the government officials who operate between the patient and the provider out of the exam room to help bring down those inflationary costs and pay for care directly, ideally in a price transparent way, where you can look and find the best value. From what I understand, can you explain a little bit more about Metashare? From what I understand, it is more of that direct purchase. So for instance, if I need a gallbladder removal, Metashare and I will work together in partnership to find the best care for the best price, and then I'll be reimbursed by Metashare for that cost?
Okay, so yes and no.
That's why we have you to clarify.
It's complicated, brother. Yeah. So there are some sharing programs out there that are direct pay or self-pay reimbursement type programs. And I'm just going to tell you, man, I don't feel comfortable with those. Okay, so think about it, Jordan. Tony, the average person, let's say you go in for a gallbladder surgery, right? And like I said, we can't even put makeup on this thing and make it look good. So nobody likes talking about this stuff. But a gallbladder surgery, let's say you're in the hospital for a night, or, a little bit of something pops up and you're in there for 2 nights and you may need some additional care. Let's say the cost on that pops up to $50,000, right? You got a surgeon fee, you got an anesthesiologist, hospitalization, whatever it is they're doing, it's $50,000. Okay. Well, if you're self-pay or you're on a reimbursement program, you are responsible for paying that $50,000, okay? And then other members will send reimbursement checks throughout whatever time frame they send, okay? While I do believe that the method and the mission is rooted in ethical and the whole idea of sharing and getting these members' medical bills paid for, I don't feel comfortable in that. Most people don't have $50,000 sitting around and they don't want to go put it on a credit card and wait for 9, 10, 12 months. Somebody send them a $300 check every month. That is not a long-term model for success. Okay. Where Metashare differs, when you go into the doctor, you got a card. Okay. It's got a PPO network on there. And so when you walk in, you're greeted as someone who has normal.
You negotiate rates then with all the providers.
Exactly. The doctors are able to file it. And it goes into another whole system now, all this PPO negotiated and all these codes and all this mess. That's another big, big problem. But it does get those usual and customary codes and those usual and customary discounts. Therefore, let's say you go into the orthopedic surgeon. This is something that happened to me a few months back. Okay. Go in, had an issue with my wrist. I like to lift and I'm not getting any younger. And so there's a little pain. So go in. First thing they're going to do is send you back there, get x-rays. They're going to poke on you a little bit. Well, okay, we need to give you a shot of whatever it was. A couple of shots later. Well, I have Metashare. I'm 52 years old. My wife and I, we've got 6 children. I've been on it for like 10 years now, which is another thing because I can sell any health insurance policy out there. The average health insurance policy, the life of a health insurance policy is 11 and a half months in America. The average life of a Metashare program is 41 months. I've been on it for 10 years. So it's a long-term success. It's a long-term opportunity to give people something that really works for them and control the rising cost over a long period of time. Back to the story, I ended up getting the bill in the mail 4 or 5 weeks down the road, and it showed where that visit normal charge was like $720. Listed all the discounts, all the codes. Everybody's seen all that stuff. Nobody knows what in the world any of it means. But somehow that visit ended up costing me $281. Well, I had to send them a check or put my card on there. That stinks. Everybody wants it to be covered. Why didn't my copay cover it? You know, that's what everybody wants, right? That everybody wants to be able to go to the doctor. They want to be able to get all the services that they need. They want to be able to pay a $30 copay and not get any medical bills. I do too, okay? And if I can ever figure out a way to develop that at somewhat an affordable level, I am not going to be doing podcasts anymore, even though I love talking to people and creating value. But, you know, it's a unicorn. It's not available. And so the whole game, in order to help people be successful, is to take on the mentality of the insurance companies or of the huge health share programs. What do I mean by that? Well, go to New York City, go to Dallas, Texas, go to Atlanta, Georgia. The insurance companies have the tallest buildings right next to the oil and energy companies in every major city in the world. Well, the way that they buy health insurance on us, or let's say on massive employers with 1,000 or 10,000 employees, is they'll say, okay, we want to cover the first 10 million, 20 million. Let's cover the first 50 million of this group, right? And then we're going to go to Lords of London or some big reinsurer. We're going to say, hey, you come in and cover over the 50 million. We'll cover the first 50. You cover the over. And they're able to keep those costs down. Well, as consumers, why don't we practice that? Because we're not taught that. We don't see that. Number one, we don't understand insurance. Number two, we don't see that as being an option that is going to be in our advantage because we want day-to-day stuff. We want now. We want everything to be paid for, just like that's the same type of philosophy and the approach of the reason why credit card debt's at an all-time high right now. Okay. And now we look at credit card delinquencies are at an all-time high. And, United States sovereign debt, we're at 35 trillion of sovereign debt because we can't do things with the money that we have and we don't know how to do it. And when we get into our personal lives, into our small business lives, buy insurance like the insurance companies do. Go with a higher deductible. Get focused on the major stuff, the big stuff, okay? And save as much money as you can and pay for the small stuff with the money that you save. Use the insurance company to give you discounts, negotiation, give you access to doctors, hospitals, medical facilities, things of that nature. But shop for your medical expenses, which nobody ever does. Nobody will shop to see how much a gallbladder surgery is going to be. When's the last time you ever heard anybody doing that? Nobody ever does that. But they shop for a flat screen for 10 months. 10 months to save $40 on a flat screen. I mean, it's the truth, guys. It really is.
I had an interesting experience recently, and talking about shopping and healthcare. My daughter was going to college and she needed a physical before she left. So I called the pediatrician's office and I said she needs physical. And they said, well, she's not due yet. I said, I know, but she's leaving for college. And we went, around and around. And they said, well, it's probably not going to be covered because it's too soon. And I said, all right, well, how much does a physical cost in your office? And she said, oh, I can't give you that price. And I said, well, if I didn't have insurance, how much would it cost? She goes, but you do have insurance, so I can't give you a cash price. They wouldn't even tell me how much it cost. In the end, she got her physical and I never got a bill. So hopefully there's not one coming, but, to your point about, all of the the sort of like, the line item expenses that you look at when you see these bills. I mean, they're completely made up numbers. You can buy a bottle of Tylenol for a few dollars at CVS, but you get a Tylenol in an emergency room and it's, $200. So there really is, I think the free market needs to inject itself so much more into the healthcare space than it already is. But where can people go to sort of find out more information about you, and about what you have to offer, and how do you think that what y'all are offering can affect the small business owners that are out there listening to you?
Yeah, so I think that what you're describing there is a scenario where there's so many different moving elements and so many moving pieces, notwithstanding the government intrusion into the healthcare system, that it just muddies the water and makes it a murkier scenario for everybody, and really a more confusing customer journey, which is you and me, the client or the patient. And so, there are ways that people can go and shop those services. There are Blue Books available. Google's a really good source as well. And then there's concierge medicine as well to help to be able to get those costs more readily available. We need more transparency at the top. Absolutely. More pricing transparency. And they have to find a way to quit allowing it's really the insurance companies to charge such escalated rates, or to force these hospitals, these medical providers, to charge such escalated rates. So it's a very, very complicated subject that I'm sure anybody wants to listen to. But yeah, if you wanted to find me, we are really happy to help anyone that needs healthcare. We can be found at redtailorinsurance.com. All of our socials, whether you go to Facebook, whether you go to Instagram, TikTok, we're all over the place. I'm an old guy trying to figure all this social media and advertising and branding out on all of those platforms. I do a podcast, as you can see behind me, the Red Hot Read Show, where we're just trying to educate as many people as we possibly can. We're continuously trying to add value and just give to the market and to the consumer as much as we possibly can.
Red, thank you very much for taking the time to join us on Main Street Matters, America's Small Business Megaphone. And thank you to all for taking the time to listen. Main Street Matters is part of the Salem Podcast Network, and new episodes debut every Wednesday and Friday. Please subscribe to salempodcastnetwork.com or wherever you get your podcasts, and we'll see you soon with another episode.